This is the brief on eustachian tube dysfunction and tinnitus relief. So, let's talk about that awful feeling of pressure and ringing in your ears, tinnitus. We're going to look at how chronic ETD causes this, and more importantly, the simple, fast-acting procedures that can bring immediate relief, even if you've been suffering for years. Okay, so first, what's the core issue here? Well, your eustachian tubes are basically the pressure valves for your middle ear. When they get stuck shut, you get this painful fluid buildup. Sometimes they even get stuck open, and you start hearing your own breathing. That whole pressure imbalance is what directly causes muffled hearing and that awful roaring tinnitus. All right, second. Look, most of the time, this stuff just clears up on its own in a week or two. But for those chronic cases, you've got to try something else. The first step is usually non-invasive things, decongestants, antihistamines, or maybe a steroid nasal spray, especially if allergies are the culprit. And finally, and this is a real game changer for anyone struggling long-term, there are swift, often in-office procedures that can offer an instant fix. We're talking a tiny little incision in the eardrum to drain fluid right away, or they can even use a small balloon to gently open up the tube. The best part, people often feel better immediately, or at least within just a few days. For those suffering from long-term ETD symptoms, simple procedures exist that can quickly restore ear function and eliminate chronic pain and fullness.